Okay, I can see Dr. Harshal has joined. Dr. Harshal, can you listen? Can you hear us?
Hi. Hello.
Hello.
Hi. Just give me a minute. Yeah.
Yeah, no worries.
Okay. Yeah. Hi.
Hello, Dr.
Yeah, just let me just remove the default background things. Give me a minute.
Sure.
Dr. Harshal, Vikrant here. Take
Hey,
your
hi
time.
Vikrant. Yeah. Sorry.
You can see the presentation now, right?
Prakashji, just put it on the presentation mode.
Okay.
Yeah. Dr. Preet has also joined.
Hello, hello. Can you hear me?
Yeah, Dr. Preet.
Yeah.
Yeah, good evening, sir.
Good evening. Kya haal hai, sir? Everything okay?
Yeah, good.
I think Dr. Harshal is going to start off and then I'll pick up all the Q&As and if there's anything in the middle also. I'm not on video at the moment. It'll come there.
Yeah, okay.
Because I'm
We would
walking
like
back.
to see your face.
Yeah, I'm just walking back home. Give me 2 minutes.
Yeah, okay, right. Take your time.
Vikrant, can I use okay, you're using the same things that I send it to you, right?
Yeah, Dr. Harshal, I'm taking your presentation.
Sure. Or I can just use my own also, so don't worry if you want. Whatever.
Yeah, we can. If you want to share, then just let us know. We will give you the permission to share your presentation.
Okay, then I think I will just use mine. Then it's become very easy. Okay. So
Okay. Prakash bhai, could you allow Dr. Harshal to use his own presentation, please?
Yeah. So I have removed my share. Now Dr. Harshal can go ahead and share his screen.
Okay, so just say, Prakash, I'm not very good in Zoom, so just make sure if I need your help, just do let me know if I'm doing it right. Okay. Okay, so I'm just trying to share my screen. Okay, so
Dr. Harshal, let's wait for another 2 minutes
Sure.
for another people join, and then we will start it.
Okay.
Yeah. Prakash bhai, you have already made Dr. Harshal as a host, right? To share that.
I have not met him host as such, but he has the sharing permission. He can share his screen now.
Okay, that's good. That's good.
Okay, so let's just give it a try. So
Yeah, try to give it a try, Dr. Harshal.
okay, is that okay? Vikram, can you see my presentation?
No, can't.
Okay, just see. Yeah, it should be on now. Yeah.
Yeah, we can see now.
Okay.
I just have a request from all the participants. Please be on mute. Dr. Harshal will start his presentation in a minute. So please be on mute.
Rahulji, shall we start? I think
Yes. We
okay,
can. I think yes.
Okay, let me just introduce the doctors panel today who are joining us, the Bhojpuri Association today. Okay, Dr. Harshal is a family physician and he is running a chain of True Clinic. and he is practicing as a true clinic at East Point at the moment, at the CMA Mall, and with his colleague as a pediatrician. So this is all about Dr. Harshal. I'm not going too deep because I want to keep it short. Dr. Preet works at CGH, Changi General Hospital, as an specialist consultant uh, in intensive care. So that's the introduction about the two doctors who are joining in the panel. And yeah, we can take it forward from here, Dr. Harshal. You can present now.
Okay. Hi, good evening, everyone. Thanks for giving this opportunity to talk few things about this bad pandemic. Okay. So before, okay, thanks for introduction. Okay, you can just call me Harshal. I think let's keep it very simple, straightforward, and easy. The whole idea of this presentation is to create an awareness. Okay, this is not a substitute where we are not going to discuss any treatment, what we are going to do. I know every one of us are panicked because of this current situation. Particularly, things are getting really bad back home in India. So I will just try to make things easy by most of you might be aware of what exactly COVID is, what are the things to look forward for. What I try to do here today is I just try to talk about what is COVID, what are the things to look forward for, what are the symptoms to watch for, when to seek medical help, and when are the things that you can do at the home to prevent the infection, as well as we'll talk a few details about the vaccination. Few things I think which we should avoid here is particularly discussing about treatment, what are the drugs to take, what are the things to do, and discussing more details about the blood test. So let's get started. Okay. As you know, means as of today, the numbers might not reflect right. We have close to 150 million cases. Good news is up to 86.9, up to close to 87 covered, but we had more than 3.1 million deaths, which is humongous number. COVID-19 is caused by the virus, what is called as SARS CoV 2, which is a new coronavirus which diagnosed in 2019. We called it as novel because it's never been known to us, and that's why it is a bit difficult for us to fight this battle. As it is a new virus, so there's no immunity against it, and there's no specific treatment for it, and that's why it caught us off guard, every one of us. So important thing is, how does it spread? So it is just like your flu or influenza. Most of the time it spread through respiratory droplet. Sometimes it spread through airborne, and mutant strain is more contagious. Uh, Less commonly, it also spread through a contaminated surface through body, all your droplets, as well as body fluids. Usually, we say the incubation period is 5 to 6 days from the date of exposure to the symptom. So that's the reason when it spread through respiratory droplets and airborne. That's why we think wearing the mask is probably one of the most important way to prevent the infection. As it is common respiratory virus, so there are some common signs and symptoms that will be see. So these will be there in mostly 80 to 90% of patients, and few of them, unfortunately, because of the new mutant and symptoms might vary. But the commonest symptoms are in the terms of all. It's just like what we call as upper respiratory tract symptoms. So you will after you get infected to virus, you started getting fever, you will develop cough, which eventually will be associated with sore throat, runny nose. Uh, these are symptoms which varies with the severity of symptoms, and it might be also associated with some another symptoms like headache, body ache, joint pain, fatigue, or severe tiredness. Sometimes you can also have nausea, vomiting, and in few of them we notice that there is a sense of you might lose your sense of smell as well as loss of taste. Then simply it will also mimic, or it will have the similar symptoms like flu, or what we call sardi khasi, say similar symptoms onge. Usually the symptoms can be worse in those who are vulnerable population. When we say vulnerable, is in particularly those who has underlying medical conditions, like those who are either too old or those who are underlying uh, lungs disease like asthma, COPD, diabetes, cancer. In those, the complications or symptoms can be worse. So these are just general symptoms that we will see. Second, any such kind of symptoms in particularly area where the infection rates are very high are eventually, unless and until proven otherwise, should be considered as a COVID, and we should seek a treatment for that. So how do we diagnose it? So important thing, as I say for example, if we see the numbers, which is such a high in India, any such kind of symptoms, we should presumably take COVID. So symptoms we can treat it in, we can diagnose it in a few ways, which we can do few tests. Most of us are nowadays so much aware that okay, every one of us knows that there are different kind of tests, which is like we can either do a swab test or we can either do a blood test. So the swab test is mostly commonly done is RT-PCR. We also do a blood test, which is serology and antibodies. All tests has its own advantage and disadvantage, so which is beyond the discussion of this topic. But I still think if possible, and it's depend on the resources where we have, if possible, we should go for RT-PCR, and then we will take it from there. Nowadays, most of the time, we're also taking in account of doing CT scan, which is called HRCT, to look for the severity of the score, but that is a different thing. So diagnosis is done by mostly RT-PCR, and once the diagnosis is done, then we need to do important things. If any one of us develop a symptoms, what we should do? Most and foremost thing is isolate yourself. When we say isolate, stay in a separate room at home. Always wear your mask. Use separate room, separate washroom. Avoid the contacts with anyone in a house. Okay. Don't share any personal belongings with your family members. You need to monitor your symptoms. Okay. And according to that, then you need to decide whether you need to seek a medical help or we can stay at home. So what are the symptoms that you need to monitor? Most important, you monitor your SpO2 if you have it at home. See how's your oxygen saturation. Any saturation less than 95%, we need to go and seek a medical attention. Second, also, if possible, if you have a blood pressure monitoring monitor at home, if you doesn't has anything, there's a few basic rule of thumb. If you feel extremely tired, if you feel breathing difficulty, if you can't breathe, these are the signs that you know things are getting worse, that you probably need to go and see a doctor. If you have fever, you can treat few things with medications at home. Say, for example, if you have fever, you can take a paracetamol. You can take 1 gram of paracetamol or Dolo or whatever crocin or whatever you had at home. Second important thing, make sure you hydrate yourself very well. When we talk about hydration doesn't mean water. Ideally, it should be ORS. If you doesn't has a hydration fluid, you can just take a glass of water, add a pinch of salt, a bit of lime in it, a bit of sugar, and that will help you to hydrate yourself. And start taking, if you have cough, cold, start taking a symptomatic medicine like cetirizine and all, and see how things goes. Only if you develop a red flag in the form of breathing difficulties, you feel extremely tired, your condition are worsening, that's the time you probably need to go home. Mind you, most of the COVID cases are still milder. Not everyone of no everyone who got COVID need to be in hospital. 60 to 80% of them still recover, just like flu. Unless symptoms become worse, then you probably need to go and seek a medical intervention. Particularly in current situation, when doctors are overwhelmed with the patients, hospitals are really full. You only need to go there when it is required. It is not only to reduce the load on healthcare, it's also better because you're not exposing yourself for unnecessary risk also. So what are the signs when you will go and seek a medical attention? Any breathing difficulty or any trouble in a breathing, it is on a red flag where you need to seek a medical attention immediately. If you have chest pain, if you notice any confusion, if you are if you think you are not able to stay awake, if you are drowsy, if you notice if you notice or if your family member notice you are turning pale, or lips are turning blue, these are the emergency sign. If you have a SPO to monitor anything situation more than less than 90 or 95 is the things, and if you can monitor blood pressure, any low blood pressure, these are the emergency sign. These are only few indicators to look for. Most important is if you notice the person is not well, he's extremely lethargic or tired and look unwell, that's the time to look for the uh, mm, seek for the medical. If possible, first try to get help to telemedications. If you can has a assessment by telemedications, or if the tele consultation available or video consultation available, get it through. Then your family physician or your doctor will advise whether you need to go for a test or you need to go for the further thing. So, what are the things we can do to prevent COVID? See, most important, wear a mask. Mask is going to be a new normal in our life for probably a next couple of months or probably next year. And this is the most effective way to prevent infection, as well as if you are infected, to pass it to others. Most important, always and always maintain a social distancing, at least a distance of 1 meter, which is important. Avoid the crowded place unless it is an absolute important things. Hand wash, frequent hand wash as possibly possible. Clean and disinfect the area as frequently as you can. Then look for the symptoms. Okay, as I told again, I think this is the second time I'm telling any one of us, if we get cough, cold, runny nose, fever, any loss of smell sensation, these are the things to look forward for the then you need to take a medical attention for this. Second thing, what we can do to prevent COVID. Okay. If possible, and if you have a chance, always go and vaccinate yourself. Which vaccines to take? Okay, because of current situation, any vaccines which is available and any vaccines you can take it, which is better. Will not go into detail which is better, which is not better. Whatever vaccine which is available, and which, if you have the chance, just go and vaccinate yourself. That's probably the best way to avoid the infection. And continue wearing the continue following the same norm, like wear a mask, avoid public places, uh, keep us be socially responsible. Vaccinations, as I say, it's an area of huge discussion. Probably will not get into it, but if possible, get into whatever vaccines you have. Just if you get a chance, just get vaccinated. That's probably the best defense that we have nowadays. Is okay. There are few things. There are few people who are eligible for vaccines, and there are few people who will be contraindicated. That means it's not advisable to take the vaccines. So who should not take a vaccines? If any one of you is known allergic, or if you are taken first dose and if you are allergic to it, okay, then definitely second vaccine is not required. It is not recommended in those who has those who are on an immunosuppressant drug, as well as any severe allergy, which are contraindication. But if you have a doubt, always discuss with your doctor, and from there onwards, you can decide whether you need to go for vaccinations. How safe is the vaccines? Okay, usually vaccines are quite safe. Any vaccines can has a tendency to give you an allergic reaction. Most of them are bit common. You can get a minor side effect after vaccinations, which is in the form of you can feel a tiredness, you can feel a lethargy, a bit of body pain. You'll feel a pain at the site of injections, muscle ache. Rarely you can get a fever, feel a nausea, vomiting, but assume the symptoms get over in 24, 48 hours. You only time you need to be worried if you started developing any rash or any breathing difficulty after vaccination. Second, what are the things that you can do at home to prevent the COVID vaccination? So prevent the COVID. One, of course, be socially responsible. Follow the normal things that all we need to do. Healthy lifestyle. Eat healthy. That's the important thing. Try to take a food which probably help you to boost immunity. Sometimes taking a vitamin C will not help you up, but will not advise to take any medications or any long-term things for the prevention and try to get a vaccination. Just follow the social norms, and hopefully things will be okay. Now I recently had a trend that probably people are trying to seek and try to get their hands on probably oxygen concentrated, keeping things at handy. I think it is probably we need to prevent doing that. Keep it for the emergency when it is required. Okay.
Guys, please be on mute. Dr. Harshal is speaking now. It's disturbing. So please be on mute.
That's okay. So I think we are trying to be a bit more open forum. So I think
Sorry,
this
Dr. Harshal, about it.
no problem, no problem. We are family, and
Yeah.
I will prefer this open discussion. So I
Yeah,
think
please
this
go
is
ahead.
this is a very a little brief about COVID. I'm not going much technical details into CT scoring. I'm not getting into medication things because I think that we will probably leave this part open for discussion and question and answer, because I'm pretty sure most of you might be having a lot of questions. Dr. Preet is one of another expert and who is a specialist who is with us. So we will be more than happy to take a question. So I will keep it short. I will cut it short now. Then probably we'll have more time for questions. Over to you, Vikram. And we are glad, me and Preeta, Dr. Preeta, are glad to take any questions if you have. Thank you so much.
Thank you, Harshal. It
Hey,
was a very good talk.
thanks, Dr. Harshal. Thank you a
Pleasure.
lot. Sorry, Preet. Sorry, Dr. Preet. Okay, go ahead, please. I don't have to say anything.
No, I think it was very good talk, complete overview. And I'm sure he's answered a few questions moving along. Let's have a set of questions so that we don't miss out. I'm sure you got many.
Dr. Preet, you want to add on top of anything which Dr. Harshal has just said, or we start taking the
May-
questions?
Look, I'd be very, I think he said everything. What really matters at the end is this is actually infectious. There are going to be variants. It's going to be a part of our lives for the coming few years. The previous SARS and MERS have been a part of our lives. They're part of our flu vaccine program. This is going to happen the way this is moving. There are going to be variants. There are going to be waves. What's going to decrease the spread is vaccination. Vaccination is not a Brahmastra. Vaccination will prevent severe infections, possibly. That's what we have to know. And even after you've had vaccination, you have to think about WMD. Wear a mask, wash your hands, and keep adequate distance. So wash your hands, mask, and distance, WMD. This is not a weapon of mass destruction. This is a weapon of prevention for us. Questions, please.
Thanks, Dr. Preet, and thanks, Dr. Harshal. Okay, I would start with the questions which we have received up till now. Our first question from the audience is: in an absence of an oxytometer, are there any definite indicators that someone's oxygen level is low?
Do you want me to take that,
You
Harshal?
both
I'll
of
take
you,
that.
anyone can take this. I'm not qualified to tell you guys who
Okay.
can take. Sorry,
Okay. So,
anyone can take this.
So Harshal works in community. I work in a hospital in intensive care. If you don't have an oximeter, which most people don't, if you start to see that the person's starting to go a bit blue, so normally, so let's start from the beginning. Oxygen saturation, 100 is normal, okay? Between 95 to 100 is normal. That's one thing we need to know. After you turn 60, 6 decade ke baad, 100 minus the number of decade is your normal saturation. So if you got a parent sitting at home who's 70, 100 minus 7 decade is 93. For them, 93, 94 saturation is okay. There is nothing very overt for you to get worried about. Fit and healthy people over 95 to 100 is okay. That's one thing to know. A lot of people who are chronic asthmatics, you live in high pollution areas, you got lung problems. If your saturation is normally between 90 and 95, it is okay. If you're fit and healthy, you start to go a bit blue, you do your saturations, then it's 90, 91, then it's something to worry about. Okay. So there are various conditions. Normal people fit and healthy, more than 95 is expected. If you are asthmatic, you have lung disease, you are a chronic smoker, your saturations may normally be 90 to 95. And you will see you start to go blue. Don't have oximeter at home. There's problem in breathing. You're going a bit blue around your lips, around your fingers. It means your saturations are low. Low saturations will normally not happen without you feeling breathless, without you feeling tired, without you feeling fatigued. If you have low saturations anyways, when you're not tired or fatigued, that means you already have lung disease. Does that make sense?
Doc, I want to add another related questions on that. Thanks for that. What are some of the exercise for people to bring up their oxygen level? I mean, this is a follow-up questions on what you have just answered. Thanks for that.
No problem. So I will do some part, Harshal probably will do another part of it. So
Yep.
breathing exercises, what I normally say is I am regularly advocating people to do deep breathing exercises, diaphragmatic breathing. So like if you do yoga regularly, you know,
Sorry, Dr. Preet,
Anulom.
what is a
So
diaphragmatic breathing?
diaphragm, look, so this is lung, underneath is diaphragm. Diaphragm is the bigger muscle. So you do the long, deep breathing. So take 1, 2, 3, 4, 5, like you do Anulom Vilom. You can
Yeah.
do Anulom Vilom. That
Yep.
works. So one nose nostril in, 5, keep it for 5, and then you leave from another 5. So do this
So
regularly.
it's like a pranayam, is it?
Pranayam, Anulom Vilom, that's what you really have to do.
Okay.
And I would suggest that you do it 2 to 3 times a day. It tends to improve it. Okay. If you have chest congestion, you're struggling, take long deep breaths, about 6 breaths a minute. That normally helps. Equal amount of inhalation, stopping, and then exhale. Don't do that, is not going to help. What is going to help is you take slow breaths in, keep it in for a second or two, and then slow breaths out. Okay. When we put patients on ventilators in ICU, we give them quick inhalation, फटाफट अंदर लिया, कुछ टाइम छोड़ा, and double the amount of exhalation. ठीक है? So
okay, that's good. That's great. Yep.
1 minute में 6 से 8, 6 to 8 a minute, not anymore. So then give yourself time. You have to time it. That will also help you relax.
Okay.
We are seeing a lot of people in big cities getting more anxious as well. कि मेरी तबीयत खराब होने वाली है, I'm not feeling very well. So that also helps you relax.
All
Anything
right.
else, Harshal, I've missed
Dr.
out?
Harshal, please feel free to jump in. But I won't be telling. I won't be telling.
That's
Yeah,
okay.
anything
So,
you want to add in, please go ahead. Please go
okay,
ahead.
so here, I mean, so we has to understand this is where yoga come in a place. We are teaching this technique for thousands of years. When yoga is concentrated more on our breathing technique, and this is what it is. Okay, so deep breathing, this is a integral part of yoga. What Dr. Preet has talked about. Okay, so deep breathing is most important thing. This is what will help. This is a short term. In long term, definitely whatever exercise you do, when you go for a walk, when you go for a run, when you do for exercise, that's also another way to build up your stamina and to build up your what we breathing thing. So I think breathing exercise is the way to go, but that doesn't mean you can do anything immediately that will not prevent you from getting a COVID. It is for you to be healthy in a long way, and hopefully you will keep practicing it, and it will keep you healthy and keep away from us.
Okay, thanks, docs. I have a third questions and I have a fourth question to follow up with that. Hopefully you guys, anyone can take it. I won't refer to any single of you. Is it okay to take what is it? Levermectin as preventive precautionary measure? I don't know what is levermectin.
Actually, that was ivermectin.
Ivermectin.
Okay, ivermectin. Okay, so it's iver. Even if COVID report is negative, but have most of all the relevant symptoms. So that's question number 1. Follow-up is same question, but for the family members who have the symptoms.
So The
Anyone can
question
take
is
it.
basically, so the question is that should we be taking ivermectin? Is that correct?
Yes, yes, yes.
So
For both
ivermectin.
sides, for both sides.
So in India, I saw a leaflet came out from Bihar. I saw a leaflet that came out from Maharashtra and one from Rajasthan also, all suggesting ivermectin, doxycycline, and azithromycin. One after the other, all three. The evidence for all three of them is not that great. If you don't have any symptoms, please do not take any antibiotics of any sort.
Okay,
Let's keep
guys, so
life.
please listen to the doctors loud and clear what
Do
the
not,
doctors are telling
yeah.
here. Yes.
I know leaflets came out from Bihar state 4 days ago from Patna. I've seen those leaflets coming out, and we people sitting in Singapore, I've got contacts up in the UK. We are actually scratching our heads, going down to say that why are you prescribing antibiotics for a viral disease when there is no evidence that there is a viral disease will cause decrease in immunity in the body that will give rise to infections by bacteria at a later time. We have to understand that fact. So if it's a viral disease, you don't have a superimposed bacterial infection. Bacterial infection kab hoti hai? When you start getting yellow sputum in your nose, yellow sputum down from your throat, from your chest. You don't have it, you're taking antibiotics for what? I'm not sure. So please do not take it. Go to a doctor, ask. The same thing stands for a lot of other medications that are being told that, try this, try this. There is no good evidence. Like there was no good evidence for taking hydroxychloroquine, there is no good evidence for taking it.
Okay. Thanks. Great. Okay. One last question from
Harshal,
my side. Questions that
just
keep on
wait,
going.
just wait.
Yep.
Harshal, would you have anything to add on there? You're mute.
Dr. Harshal, you're on mute. Please
Okay.
unmute
Okay.
yourself.
Yeah. Okay. So as Dr. Preet has correctly pointed out, we're dealing with a viral illness. It is same like your flu. Only thing is it just become worse. If you take antibiotics, it's not going to make you better, but if if time arrives when things become complicated and if you need an antibiotics in future, it might not work. So I don't know from where these things are coming. If I see these leaflets, if I see this, I'm sorry to use the word like cocktails of medications which is prescribed, which is
Correct.
which is absolutely against the fundamental principle of treating
Yeah.
things. That
Lots
means,
of WhatsApp gyan is also going around and
see,
forwardings.
what
Yeah.
happened is this is
Yeah.
this is a panic situation.
Yep.
When people get panic, people
Yep.
will look for the help. But say it is logical. You can't have 5 different type of medication for viral illness. If it's required, doctor will prescribe it. So don't go yourself. Starting getting antibiotics, getting medications, getting steroids. When it is required, they will give it. So taking antibiotics in viral illness, if it's absolutely not indicated unless and until your medical practitioner advises it.
Yeah. Okay. Thanks, Doc. Thanks, Doc. Uh, Moving
No,
on to the
go,
next
go.
question. Uh, why there are is still chances of infection after second dose? I think this is everywhere. Is the question in the whole world, including Singapore. Um, is it true that doses create immunity disbalance immediately after it? The person regains more immunity after certain days of doses. Sorry,
Uh,
sorry, my English is not clear here because the question was like that. So I am trying
okay,
to.
so I will try to take it about vaccines. If it okay, so I mean, if I read on the screen, is it true that vaccine first decrease the immunity and then after a few days it increase apart from the known side effect?
Yeah,
So
could be. Yeah,
yeah, so
you can address that.
vaccine doesn't decrease your immunity. So what does vaccine does it? We inject a part of virus where your body will develop immunity to it, and that's why when you develop immunity to it, that's why you get this side effect of vaccines or you feel lethargic. So unlikely your immunity will be down after first dose of vaccine or it will be up after second dose of things. The reason you need a second or booster dose is to increase the production of antibodies in your body. So vaccine does not decrease the immunity. Anything, Dr. Preet, you have to add on?
I think there's a lot of talk about decreasing immunity. That's not the case. it does whatever vaccines that are being produced at this point in time, there is no injection of coronavirus. There is no chance that you can get infection from corona by the vaccines that we have in the market. So we have to be careful what we are looking at. Some people, some evidence sometimes suggests that the immunity is decreased, the reason people feel lethargic, but that's body which is bringing out an immune response. That's something you need to be very clear about vaccines. Number two, people
I
have
think this is a
vaccine
very
one.
important point, Dr. Preet. Can we repeat it for all the audience one more time?
So vaccine one, evidence it decreases immunity or it doesn't is not clear. However, whatever symptoms you get is because body is trying to produce an immune response to the part of virus that has been pushed in. There is no injection of COVID virus in the vaccines that we have in the market. The Covaxin, the Covishield that we have in India, the Pfizer, the Moderna, the J&J, none of them have a coronavirus. They don't have coronavirus in them, full stop. There is no way you can get coronavirus infection from the vaccines which are currently available in the market. I have no idea what Sinovac has or what Sputnik has, but whatever has been declared, there is no coronavirus in there to give you a coronavirus infection. So that's something we need to know very clearly. The body will develop an immune response to it, because you put anything foreign in the body, it produces an immune response. And that's why it is. And it will fight off. Vaccine will not, because you are not injecting corona itself. It is not that you cannot get an infection. You will get infected. What they're doing is they're putting in, as Dr. Harshal said, they're putting the small parts of the virus or heart of the virus in the body. Body immediately recognizes it when it finds coronavirus or its particles, and then puts in an immune response. There will be an immune response. You will get a bit of flu after the vaccine, but even after you've had vaccine, if you get coronavirus, the illness is going to be less severe or very mild, is what we have found. The Gangaram doctors, 5,000 of the doctors, about few hundred got infected in Delhi. None of them is critically ill. They all got discharged one after the other. If you follow up that news from Gangaram from Delhi. Doctors down from AIMS, they got infected. They all recovered one after other. So the body has pulled out a very good immune response for these doctors, for these people to get better. The adverse reaction leading to death, clotting, and so on and so forth is very, very rare. They have given vaccines to more than 15 to 18 million people. India, they're vaccinating like right, left, center. I'm talking about Pfizer, biotech, Moderna ones. Vaccines are very safe. There will be some adverse effects. We have to remember, every time you try go to a hospital, 1 in 500 chance that you will meet with an accident. If you have a vaccine, there is 1 in 100,000 chance you may have a problem. Put
Doc,
that in perspective, please.
Doc, I want to obstruct you here. I have follow-on questions on what's going on right now in India, based on what you have said just now, both of you. So basically, you do not have to believe on rumors that the vaccine belongs to some political party or vaccine belongs to whatever. You should go and get vaccinated. This is the message, loud and clear from the scientific
100%,
community.
100%. Get any vaccine you have in the market. It doesn't matter. They've done tests on Covaxin, Covishield. It was released 10 days ago. It's very clear in headlines that it isn't picked up by international media. And it is to be believed. The efficacy is upwards of 75 to 80%.
Thank you, Doc. Thank you. This I think this should be conveyed to all of the community and whosoever we are in contact and everybody. I have this list of questions as of now, which I have prepared and got it. I would now like to
sorry.
our colleague Rahul and Prakash, if they have gathered any questions which have come onto the chat, they can they can ask.
Yes.
Please go ahead, Rahul.
Right?
Just give me 1 second. Harshal, you had something to say about vaccine. Would you mind finishing that off, please?
Okay. So as Dr. Preet said, see, the only way to fight corona is a vaccination. So I think, everyone, there's enough data, everything is there. The only way we are going to win this battle is vaccinating everyone. And it is us who are on the front liner who are the first one to take it. So if it's not safe, I don't think so we would have taken it. So just go and get vaccinated. Don't think about it. And if you need to know the information, trust the information which comes from the reliable source, not from the WhatsApp, not from the news, not from anything. If you want to know, Google it, but Google to a reliable source. Uh, after we
CDC.
Yes, after we yes, so
CDC.
CDC is a center of disease, which is most reliable things. You can go on a healthhub.co.uk, and at the end of the topic, I'm going to share a patient information brochure, which is from reliable source, which will share with you, which is 2 pages document, which has every questions about uh, COVID, which has even a link for you to look into reliable sources that I will pass it to Vikrant, and Vikrant will be able to circulate to all. So please get vaccinated. That is a loud and only message which probably we need to pass at the end of this talk.
Dr. Harshal, I would like to thank you first. I hope that you're not getting late at taking few more questions. Sorry about it.
No,
I
it's
know
okay.
I
Yeah.
know you have a commitment somewhere else in India at the moment, and you are helping a large number of community over there. Uh, if you're okay, we'll continue with
No,
that.
no, we should. We should. I think we are having a good discussion.
Okay, and
Let's
then
take the
I will
questions.
pass it over to my colleague Rahul Tiwari ji and Prakash Nirala ji. They might have
Yeah,
compiled
thank
some
you,
more
Vikranji.
questions on that.
Yeah, thank you, Vikranji. I am just getting it from the chat. So, I think there's one question which is coming, like, again about the treatment. There is, it's basically, like, by which day the fever expected to go down if the person is already, COVID infected. I think, it's a follow up on the same question is that, let's say if the fever is about 101, right, since day one, and even today also it's continuing, like, when the person should see that the fever should go down. I mean, let's say if he's recovering, everything else is going fine.
So I will just talk, and then I will get Dr. Preet to talk about it. So let's talk about fever. Okay. So what is a fever? Fever is just a sign that your body is reacting against any infection. So that is viral, bacterial, or anything. So we are not bothered whether you have 101-degree fever, 102 fever. Fever shows that you are still having ongoing inflammation or infection in the body. Paracetamol doesn't cure your fever. It just symptomatically relieve your fever. You will be getting fever till the time you are having infection. So if it's a milder symptoms of COVID, usually it recovers in a matter of few days. If you're having persistent fever, which goes beyond say 6 days, 7 days, or 8 days, and you are not getting better, though you are not showing any worsening sign, that's the point of time you probably need to get few more tests done to see there is no secondary ongoing bacterial infection. And these are the things that you need to look forward for. So always remember, fever is just a sign that your body is reacting. Paracetamol doesn't cure your fever. You take paracetamol to decrease the symptoms or relieve the fever, so your stress because of the fever in the body goes down. So that's one. And we are not yet sure which day you become of April. That means when your fever goes. It's depend on the severity. So sometimes the COVID can be as simple as like your normal cough, cold, and flu. It get better in 6-7 days without even doing anything. In extreme cases, it can be life-threatening, where unfortunately you succumb to death. So it's depend on the spectrum of the disease. So there's no clear-cut answer here on which day you will be febrile. But yes, if your fever is getting better, you are not getting regular fever spike. That means you are getting better. Dr. Preet, you have anything to add?
I think you're very right. It takes about a week at least for it to get better. It's just like a normal flu, and starts off there. Persistent fever is an indication that there is something else going on. And you will find that the fever normally comes in spikes, about 12 hourly or so in a lot of people. So you will find comes with a bit of chills. And it's standard for this one to have it up till a week. But you have to look for other signs. You have to look for other signs, but this is a symptom the body is fighting it. And if the patient then starts to have a lot of sputum, yellow sputum, or starts to have other issues, breathlessness, decreased saturation, it's time to think about going to a doctor. Normal fever is not an indication that you go start running towards a hospital.
All right, thank you, doctor. So just go with another question here is, let's say, a person who is uh, got positive after the RT-PCR testing, and but there's no fever, and even the oxygen level is never went below 98. So should he go for CT scan? I think CT scan is something which is commonly people are now trying to go and get diagnosed and get further diagnosed with CT scan, right? So what is your recommendation on that?
Okay, I'll take that, Harshal, if that's okay.
Yes, please. Yeah.
Yeah. So I'm a Sikh, asymptomatic, RT-PCR positive. Bhangre dalo. Get isolated. Keep it very simple. Keep it very simple. If RT-PCR is positive, your asymptomatic saturations are okay, please isolate yourself. That's the first thing you need to do. And just monitor your condition. Please isolate for at least 7 days. Get another test in 7 days down the line is what you really have to do to make certain. Look, every test can be false positive, false negative. If you're asymptomatic, everything's okay. Stay at home, take precautions, isolate yourself, take good hydration and nutrition and so on and so forth. Nothing to worry. Full stop. Take another test 7 days down the line. That's what we normally do. And remember one thing, you're most contagious when you're asymptomatic. And it is now a known fact. You can spread a lot of infection when you're non-symptomatic. So you have to be careful about it. Now, the second part you asked
one
about.
question here, sorry to obstruct you, that is the steam is helpful if the person is taking, even if it's not symptomatic?
I will come to it.
Yeah.
Let's finish the CT scan question first. CT scan is done to stage the severity of disease. You don't have a symptom. What are you getting CT scan for? That is my question for you. CT scan that we do and the CT scan values, I am on Twitter, I am on health groups, and I get tens of questions every day. My CT score is this, doctor, what should I do? Or I've gotten an RT-PCR test, my CT value is this, what should I do? First and foremost, you don't need to get CT scan of your chest if you're asymptomatic. CT scan is only required when you start getting symptomatic, start getting a lot of breathlessness, and you cannot manage. That's when you get CT scan. Without that, please do not spend your time, money, or resources in getting a CT scan. I hope that answers that question. Now, coming on to the steam part of it, taking steam every day is good because it moisturizes your airways. If you have throat and chest congestion, steam is what is now told to be the main thing. Gargling, we are not suggesting as much. Steam is much better a way to go, morning and in evening time. But after taking steam, please do not sit in an air conditioner. Take normal precautions. I would also suggest that you take hot drinks throughout the day. That means taking some warm water. Please refrain from taking cold water. Behave with this as you behave with a normal cold and flu, and you will be okay. There is nothing to be worried about. 98 to 99% of people are recovering and getting home. Please don't make it into a hawa. Most people, 98%, get better and get on with it. Media is playing crooked sometimes. Yes, we are struggling with some problems in some parts of the country. That doesn't mean that the virus is a killer virus.
Okay, thank you, doctor. Thank you so much. I think that verifies.
Harshal,
Okay,
Harshal, you
so
wanted to?
just need to add one more thing. So what Dr. Preet says is very right. If you are asymptomatic, your symptoms are not really bad, don't go yourself, get tests done and get into a trap. Because if see, for example, if you are well and if you ended up doing a CT scan, your score come say 10 and 12, what you are going to do? You will be definitely will be exposed for another CT after 7 days. Second, we don't have enough CT scan centers available across India. You are unnecessarily burdening the system. So only do if is required, only do if your doctor's advice. And second, don't try to interpret blood test by yourself. If you can interpret by scoring or blood test just by doing a Google, I think you don't need us. So your blood test never make a diagnosis. It's your symptoms, your clinical examination, and your blood test. So blood test or any test are supportive for the diagnosis. So don't do it by yourself unless it has been advised. I'm sorry, I might be too rude to say, but you are just unnecessary wasting the resources, as well as you are exposing yourself. Who does the CT scan? Those who have a severe disease. You're actually going and exposing yourself. Second, because of you who are spending 20 minutes in CT scan, somebody who might need a ventilator and dying, you are denying him a scan. So only do it if you are not well and if you are absolutely sick. Don't do it just by sake of doing it because RT-PCR is positive. Means it is going to be positive unless you are breathless or there's an indication then, and then only do it.
So,
Completely agreed.
Dr. Harshal,
Yeah.
If really the RT-PCR is positive here, and then how do the person make sure that he should not go for it for the time being?
Okay, so now, okay, the reason we are going to do all these things because we are afraid. Okay, and when we are scared, we don't make a sensible choice. We just want to do things to be safe. Okay, so one, if your RT-PCR positive, okay, if you have seen my first slide, 150 million cases, 86.9 millions recovered, 3.1 death. 90 to 98% symptoms are recovered by itself and it's a mild disease. You only need to get your scan done only if you have worsened symptoms, you have breathlessness, because by even doing a scan, things are not going to change. But you are going to expose yourself. See, we are not going to have portable city. You have to go to a city center. There will be the sick critical patients who are there. You are having viral disease. Your immunity is low. You will be exposed to another secondary bacterial infection. So only do it if your doctor advised to get it done.
अपने
And-
आप मत जाओ.
Yeah,
Keep
yes.
life simple.
And
If
that's
your
true.
doctor advises, तब जाओ.
Yeah,
बात
and
खत्म करो बाबा.
Got it,
जुगाड़
got it,
मत
got it,
लगाओ.
got it, got it, got it, dogs, got it, dogs, got it, dogs. And I hope everyone got it here. Got it. Rahul sir, please go ahead.
एक क्वेश्चन और है डॉक्टर्स के लिए. आई थिंक आई टेक जस्ट 2 or 3 minutes. So again, this is about the vaccination. I think you did speak that, I think in India, right, I think there is some problem going on. Like some people have got their first jab already done, but for second one, they probably don't have an idea whether it is available, or I'm not sure. Some people are having that they don't have the dates for second jab. So the question is basically around that line, like should they try to just get it from anywhere or any center, because second jab is as needed as first one, so they should complete both the doses.
I'll
What
take
do you-
that. I'll take the first stab at it.
Yeah.
Looking at experience from the UK and the US, let's not talk about Singapore here. They didn't have enough vaccinations to begin with. What they did was this mass vaccinated more than 50-60% of the country with one vaccine. Okay. Vaccination that happens in some countries takes between suggested time frame between vaccine dose 1 and 2 is between 4 weeks to 11 weeks. What we're doing currently within 4 weeks is an accelerated program. Single vaccine dose is providing up to 60 to 80% effectiveness. If you get the second dose within 2 months to 2.5 months, it is okay. Vaccines will be produced in adequate quantities, they will be there. I would not worry about it. Even if you've had one dose and you're waiting for the second dose, it'll come in 2 to 3 months at the most. That is okay. My family members in the UK, they've had one vaccine at the beginning of April. The next vaccine is in middle of June. That's 9 weeks. So please don't worry. 2.5 months is okay. Remember, when your child's born, you get vaccinated every 3 months, 0, 3, 6, 9, 12, or something of that sort. So vaccines take their own time to build immunity. There is no hurry that this needs to be vaccinated within 3 weeks. When I got vaccinated here in January, we were vaccinated within 3 weeks. It's been now rolled out into the community. It's now 4 weeks. So accelerated vaccination is one part. Standard, you make people wait about 6 to 8 weeks. That is okay. In the UK and the US, people have had one dose of Pfizer, the next dose of Moderna, or the other way around. So that thing that you have to also remember. In India, it's a different case between Covishield and Covaxin. They're at the moment not mixing it with one another. So I think there, the science is not very clear. For Pfizer and Moderna, the science is clearer that you have two vaccines, one of each. It doesn't matter much. At the end of it, there's still efficiency more than 90 to 95%. Does it answer some part of your question?
Yeah, definitely. I think so. The message, I think, is very loud and clear that, you know, if you can, one, yes. If you are not able to do the second, wait for it, and, you know, as and when you get chance, get the second jab as well. So I think that's the message to everyone. I think we are done with most of the questions. I have just one, doctor. You know, like many of us have, you know, we prepared ourselves last year, and also, you know, this year we are preparing. Basically, so in terms of medicines, right? Would you recommend anyone to, you know, keep some medicines at home? Like, you know, so for example, like tomorrow, if you are getting infected, or if anyone and, you know, extended family getting infected, just be prepared yourself with certain medicines, keep it home, so you can, you know, fight with initial symptoms and get recovered easily.
I think I will take this. So this is typically okay. There are few medications, despite of any part of year or any part of time you need to have at home. Definitely, you need to have basic medications like paracetamol at your home, something for hydration, ORS at home, few anti-allergy or for cough and cold medications that you can keep it at home. But don't try to hold on the medications like azithromycin, there are some antiviral medication that people take, ivermectin. These are ivermectin. These are not recommended to take by yourself. So keep basic medications at handy, like paracetamol for vomiting, for your flu, like cetirizine, or whatever things that you can get hold of. Hydration, if possible, try to get a vitamin C and things, but don't hold on the antibiotic, don't hold on the antiviral unless and until it is advisable or it is prescribed. Because one, these antivirals and other medications are very rarely used. If all of us try to hold it, those who rarely need it or those who need it who might not get it. Dr. Preet, you have anything to add?
I think that's pretty much sums it. Please don't hold any medications. Whatever medications you need for normal cold and cough, the same medications work. So please don't try to go out and get medications which are not required. Antibiotics, remember one thing, you're using antibiotics for infections that are very mild, then that means the bacteria will become more resistant with time. Think long term. Antibiotics are only required if there is bad bacterial infection. Taking antibiotics at the beginning, you are not doing a favor to yourself. You're doing a difficult thing, not just to your own self, to your own body, but to other people. You're making viruses and bacteria more resistant.
Thank you, Doc. Prakash, you have any other questions, or we just?
I think there is just one last question.
Yep. Please go ahead.
This question is related to this second wave and the third wave.
3
right?
doses. I will
Yeah.
answer. It's the third vaccine dose. UK has just ordered the third vaccine dose, 60 million doses from Pfizer to be arrived by December, because Pfizer released a news statement last week, 10 days ago, that there might be a requirement for third dose. Yes, the studies are not very clear. Remember, this vaccine has been developed in under 9 months, something that takes up to 5 years. The science is evolving. Tomorrow, if I say something different than what I'm saying today, because the science has evolved. At this point in time, they are saying you might need a third vaccine. We are not sure. At this point, they're also saying the antibodies that the body is making may not be sufficient in 6 months. We still don't know. The science is evolving. That is the answer. Please look for it. If you are struggling, please go to your medical service provider. Go to a doctor, to a physician. Please do not believe news reports. Research suggests a lot of things. Tell me something. WHO last year said it is not an aerosol disease. Now science has evolved in a single year to call it an aerosol disease. So science is evolving. Please look out for it. We are not sure. As Dr. Harshal has said very clearly, don't buy rumor.
Doc, interrupting you here on the aerosol question. Does anyone need to have a special precaution for this aerosol thing which has come up recently?
So aerosol infect. So it has been going around in medical circles for the past 6 months, by the way, because there wasn't a clear evidence. So it's now come in. Any closed spaces, enclosed spaces for longer than 30 minutes with someone you know, you are a close contact. Prefer not staying in closed spaces, air-conditioned places. Sorry, most of us work in offices and office spaces which are air-conditioned.
Even if
They
you are
are
masked?
If you are in that space for longer than 15 minutes with a close person who has COVID, you will be counted as a close contact if you are in Singapore.
Okay. All
Singapore, 15 minutes with a person who has COVID, you are with them in an enclosed space, you will be counted as a close contact and be quarantined.
And how about back home?
Back home remains the same. Thankfully, वहाँ पे हर जगह air conditioners नहीं है, हम बच गए हैं.
All right, great.
When it's an open environment, the virus is diluted. The particles are diluted. Now, you might ask me, how long does it live in aerosols? Up to 3 hours. That is the evidence.
All right.
You,
Dr.
you
Harshal,
go out,
anything to add on that?
I mean, I think Dr. Preet summarized everything. And even if you come in a close contact by wearing mask, that's what Vikram is asking. Yes, it is still considered as a close contact because the mask doesn't prevent 100% of transmission.
N95 means 95%.
All right,
There is
got it.
There are N98 masks as well, by
Yes,
the way.
got it. Prakashji, any other questions before we get the doctor released from here?
This was the last one. Thank you, doctors.
Okay, Neerajji, you got any last word? Neerajji?
You will have to unmute. I think you are on mute. Neeraj ji.
He's mute, but he might be listening it. All right, all right. So thank you, both of you. Thank you, thank you, thank you.
Yeah, no, I'm good. Thanks to the doctors.
Pleasure.
All right, all right. Neeraj is speaking. Yeah.
Yeah, right. So I was on mute actually, and it was very many thanks for your time. It was very good for community. A lot of information we got, right? And really thanks to the Vikrant also for arranging all this, and Rahulji and Prakashji. And if any questions like any of the members, any of the people attending here they have, right? Maybe post your question to Vikrantji, right? He might not get the answer immediately, but you can contact our doctors, and get the answers actually later. So thanks everyone.
Thank you so
All
much.
right, docs.
Thank
Thanks
you.
for
Thank
your
you.
time.
Bye.
Okay.
Thanks
Thanks.
for your time.
Okay.
Stay
Thanks.
safe. Stay
Okay.
safe.
Stay safe.
Thank you so
Thank you
much.
very
Thanks,
much, Dr.
everyone.
Harshal and Dr.
Good
Preet.
night, guys.
Bye.
Good night,
Good
guys.
night.
Yeah.
Thank you. Good night.
Thank you. Thank you, everyone.